Okay, thank you, Otto. Yeah, my name is Mikko Kytö, and I'm presenting one of the examples of Clever Health network project what Katarina explained in the previous session. So my project or our project has dealt with gestational diabetes. So it's a diabetes that develops during pregnancy, and this project has been done together with Fujitsu, Elisa, Aalto University, and University of Helsinki. And we at the HUS have been the main research partner in this project. So why it's important to treat gestational diabetes? It's very common due to the increased number of obesity. So there are approximately 20% of pregnant women receive this gestational diabetes diagnosis. So it's affecting a lot of pregnant women and the next generation. And this TDM, in fact, actually imposes type 2 diabetes, so increases the risk of getting type 2 diabetes 10 times compared to without the diagnosis. And the metabolic risks are also significant in the next generation. So this is really important to manage well. The challenge that we aim to solve is that the monitoring of women with gestational diabetes is not sufficient. So the women with gestational diabetes take this fingertip measurement once a day or sometimes a couple of times a day. And this doesn't provide the full picture of the glucose levels. And also the information that is given to women with gestational diabetes are dated, so they are pretty much the same information, general leaflets and that kind of very general information. Our approach is to make these things visible so that the women with gestational diabetes can follow their glucose together with their lifestyle in real time. So this provides continuous information about the blood glucose levels also during the night times, and also they are able to monitor their weight and during the pregnancy, and also we can measure the weight and body composition of newborn. So typically the women with gestational diabetes give birth like very large babies, so we can reduce the number of macrosomic babies with our approach. So this is the basic concept of our approach. So we have a pregnant woman who is using these devices, and they can see the information through the mobile phone screen. And this same information is shared with the healthcare professional and researchers in real time. So the service concept is easy-to-use mobile application that combines all this information into a single view. And the main idea here is that all this learning that the mother needs to do, how to manage the glucose levels, is made by themselves. So they don't get any extra guidance or feedback about their glucose levels. So everything that they learn, they learn from the data that they collect themselves. And we did quite a lot of desk research on the topic. So there are a lot of qualitative studies on gestational diabetes that we first looked at. Then we engaged the women with gestational diabetes to use these different sensors. We tested multiple types of wearable sensors and their apps, what they like, what they wear most, and so on. Then we prototype different kinds of features to the application and ask feedback from the becoming mothers. And then finally, we did this minimum viable product that we evaluated in this randomized controlled trial in order to evaluate its effectiveness to manage gestational diabetes. This is how the app looks in practice. So the person is wearing this continuous glucose monitor and is keeping a food diary. First, we actually had this speech-enabled food diary, but the world wasn't ready for that. But now with the improved natural language processing, I think this would be again a good solution to try out. Then the participants used this activity bracelet, and they also measured their weight. And all this data was visible in the app, so that the mothers were able to view their data on a weekly basis, a daily basis, or even hourly basis. And they were able to see how the different nutritional facts about their meals in a very detailed manner. And there was also information section about the gestational diabetes and pregnancy and the fetus. So in this randomized controlled trial, we did this in a very in a classical way. We did a baseline measurement for women with gestational weeks from 24 to 28. And they were randomly assigned to intervention group that used our application 1 week a month, and in addition to standard care, versus a control group received only the standard care. Then at the later stage of pregnancy, we did a measurement, and at the birth, we did more measurements, and we also had a follow-up study at 3 months postpartum. And in order to make an objective comparison between the groups, we used multiple sensors. This first beat lifestyle sensor, and then the physical activity sensor from UKK Institute. This was also a bit of gauge or handle the Hawthorne effect, so that both groups were observed in the study. And the principal findings were very good. So we found that this was actually effective, and this was the first periodic digital intervention that was shown to be effective without the feedback from healthcare personnel. So the women with gestational diabetes really learned how to manage the gestational diabetes and what kind of relations there are between their lifestyle and the glucose levels. So the participants had lower glucose levels, they increased their vegetable intake, improved physical activity, had lower gestational weight gain, and there was reduced rate of macrosomia. So there were less babies weighing over 4 kilos in the active group. And what's important is that this improved clinical outcomes correlated with the usage of EMAM. So the more they use the EMAM application, the better the clinical results we were able to see. And the EMAM, what was the role? It was that they really empowered the women to manage the GDM effectively. And this was actually a learning process, so that we actually have another publication coming out of this, but it was really about learning, not motivation. The motivation to treat GDM was very high in both groups, so the mothers were motivated because of the sake of their child. And what differentiates these results from the existing results, that there was no guidance from healthcare personnel, and it was all visible in one app, and we used this periodic approach. And in the future, we aim to develop also AI-based suggestions, because we try to make this application accessible for all the persons, so that you don't need so many good data literacy skills and kind of health literacy skills to learn from your data. So the AI recommendations are like shortcuts for mothers, like eat like 2 potatoes instead of 3 potatoes, or any kind of this kind of very concrete and personalized suggestions would be the key. So we are here now at the second generation, and we try to come up with artificial-based predictions and such recommendations for the mothers. And there's some work on this, as seen from the image. Again, this three-handed woman appeared here for the from the AI. So there are some rules to really consider here, how to create these predictions. One example of AI study that we did is that we investigated how we can use the data from healthy group to fulfill or like make additional information for the data modeling, so that the typically pregnant women don't have much high intensity physical activity. So it's very difficult to predict what are the glucose levels after the high intensity physical activity. But then we get this data from healthy group, and we can transfer the learning to our case. And we were actually able to improve the glucose levels predictions when we added this data from the healthy user group. So sum up the benefits of our solution. So we have really improved the clinical outcomes, and this real-time information is really key for mothers to learn from the data. And this data also provides opportunities to make these personalized predictions and recommendations to support behavioral change. And this is also a scalable solution. So one can think of applying this in this, for example, for persons who receive type 2 diagnosis. They might, in the first stage, they might need some support in the learning how to deal with the diabetes. So this might be a good tool for them in the, at least immediately after their diagnosis. And we are planning to do a continuation study in maternity clinics. So we want to study this in real context, and we, for example, our participants were quite highly educated. We want to investigate in this other context, and also we try to investigate how this fits into the whole treatment path from primary care to special care, and what's the impact of this solution on healthcare personnel's workload. Thank you.